born and raised in a small Ohio town, and I used to watch Dr. Kildare on television. I don't know if you remember Dr. Kildare and Ben Casey. They were two doctor shows. And I was sort of inspired to become a doctor and save lives and, those typical things. So I went to Ohio State Medical School, and then after that I went into infectious disease, and then I went to London to train in tropical medicine. This would have been 1980, 81. I decided that I wanted to put my training into practice somehow, and so I talked to a few people that had worked in global health. Everybody agreed on one thing, and that is don't go to Sudan. That's the worst place you could possibly pick. And so that's, of course, where I decided I had to go. Ended up in eastern Sudan, where there's no electricity, no clean water, with a volunteer project where I didn't get paid. It was a fantastic experience. In late 84 and early 85, I worked in an AIDS clinic at the LA County General Hospital. By the time I left to come to Vancouver in June 85, we had 400 patients with HIV, which was actually more patients than all of Canada had at the time. So the job that I ended up taking was Director of Venereal Disease Control.
I did my medical school in Ottawa, and then I came out to Vancouver to do my family medicine. Just was coming out of the closet, and so came out to Vancouver to do my residency. Because I was having some trouble coming out, I guess I felt I needed to study things, so I did a elective rotation at the BC Centre for Disease Control, and studying sort of gay men's health and the gay men's health movement, and trying to really understand what it was all about. After my residency, I went and I worked in Victoria as a medical health officer till the sort of job, my dream job, opened up at the BC Centre for Disease Control, which is where I've been ever since.
The test became available to the public in BC, I believe in 86. BC was the first province to make it available to the public. The testing clinic wasn't that busy in the beginning. It was less busy than we anticipated. But then it started to pick up as AIDS got into the news. I remember when Rock Hudson admitted to having HIV, and we had a surge in testing around that time. And then when Magic Johnson came out as being HIV positive, there was another surge. That was a different situation because it was always assumed that he was heterosexual and had picked it up through heterosexual contact. So we started out with non-nominal testing in BC, and we have always had non-nominal testing. And that implies that people can give any name or number that they want as long as the healthcare worker can contact them in the event that they don't come back for their results. So we had a lot of unusual names and contacts. I remember Bill Vander Zalm was used a lot. Remember, we had a Ronald Reagan 1, a Ronald Reagan 2, and 3, so we knew which one was which.
Testing has changed a lot since then, and in what I think of as two ways. First, in how the testing is done, and second, in the types of tests, because the technology of testing has changed substantially. The control around testing is not just in the labs anymore, and it's taken out of the hands primarily of physicians as we start to see greater use of things like point-of-care testing, with point-of-care testing being done in non-traditional settings. A point-of-care test is a test that is done quite rapidly and can give you a result within minutes. It's an antibody test. There currently are still two options when it comes to reporting. There's the nominal reporting and non-nominal reporting. And if someone chooses non-nominal reporting, what that means is that their identifying information is not included in the report that goes to public health. So we don't yet have sort of fully anonymous HIV testing in British Columbia, but that was the measure that was put in place to allow people who do have concerns around their privacy to test.
The AIDS conference in 1989 was in Montreal. We decided to have a video on AIDS promoting condom use that we would show at the table, and so we contracted with a young up-and-coming singer back then named Colin James. He did a video called Always. Closing shot of the video was Colin James bent over a jukebox, and then he looked into the camera and he said, "Always wear a condom." Well, that was very controversial even in 1989. About halfway through the conference, we got a call from the Premier's office telling us that we had to stop that video because it was offensive. We sort of forgot about that call and continued to run the video for the whole conference. There was an article I remember in the Sun about Van der Zalm banning the video. And the information was leaked from an anonymous source at the time, which was me. And so I remember being interviewed on the first hole of a golf course around this banned video and who was the source and the leak, and I, of course, said I didn't know or something like that and teed off. I went to the Washington AIDS Conference in 1987 after a talk by an expert named Don Desjardins. I asked him what he would say would be the most important elements of a prevention campaign. And he said three things. He said needle exchange, outreach, and treatment programs for drug users. We decided to take that advice and to set up those three elements for Vancouver. We decided at BCCDC to take up the outreach area in that program. We developed the Vancouver Street Nurse program. As street nurse, you can do the testing that needs to be done yourself. You don't have to refer somebody to another clinic where they oftentimes don't make it. You can change the dressing on the street as opposed to trying to get somebody to a hospital.
The kind of role that BCCDC took was more related to prevention and testing as well, with a focus on sort of the most marginalized of populations, which is in part, the start of the outreach program and working with our street nurses. They're a very dynamic group of nurses who've really been evolving at the front lines of the HIV epidemic in Vancouver, being some of the first nurses to do outreach nursing on the street, being sort of at the forefront of harm reduction and bringing services and healthcare where people are. Daphne was one of the nurses who would do whatever she could to try to get information about new HIV diagnoses, and it's in part because of her efforts that we have some information before 2003 when HIV became reportable, so that we know a little bit about the early epidemic in terms of trends in different groups. Community partners are essential to everything we do at BCCDC. So whenever we're trying to deliver a new service or a new program, we are often talking to community partners. We're trying to figure out if it's something community needs. We're trying to develop programs that are needed by community. The things that we've been talking about at BCCDC is a couple of things. So we, as we are building a sort of a suite of interventions that are online, so internet-based testing, to starting the very first cyber outreach program for nurses, as far as I know, anywhere in the world, where nurses would go online and go into chat rooms, for example, services that are by patrons of sex workers offering advice and counseling, and that has sort of really was sort of the crystal that led to the development of our online services that we've expanded since that time. We really see that, again, our expertise is thinking about core groups. So who in the population are people who are most at risk, and the people who are the core group that continues to drive the infection, and thinking about ways that we can actively engage those groups. We're trying to think a little bit broader and thinking about how HIV and hepatitis and sexually transmitted infections such as syphilis are all circulating together, and how they sort of synergistically interact to contribute towards new HIV infections as well. So we are trying to take a little bit more of a broader sort of multi-disease model in terms of how we go forward.
I'm proud of the fact that our program grew so well. When I started, our budget was, I think, $800,000. We had about 19 employees, and when I retired, our budget was over $6 million, and we had at least 60 full-time employees. I've always felt that we had the strongest provincial program in Canada, and one of the best provincial government-sponsored programs in the world. I'm going to be working with Médecins Sans Frontières for the next year at least in Swaziland, which has the world's largest HIV and TB epidemic on a per capita basis. So I'm sort of returning to Africa after being there in '81 and '82, and we'll see how that goes, but I'm quite excited.